New Zealand's Prime Minister is taking radical steps to contain COVID-19 there. Jacinda Ardern said today, "We only have 102 cases, but so did Italy once." She is now imposing a month-long nationwide lockdown. Every household will go into self-isolation from Wednesday night for at least 4 weeks, apart from people who work in essential services.
These decisions will place the most significant restrictions on New Zealanders' movements in modern history. Over the next 48 hours, people will need to go home, be it locally or throughout the country.
And Prime Minister Boris Johnson put the UK on lockdown today. He gave the police special power to arrest and fine people, still ignoring the advice to keep some physical distance from each other. In London, parks have been packed. People have crammed into the underground, even though cases there have surged to almost 7,000 and 55 people died today alone. Here's Goomansingh.
This was the scene on the Tube Monday morning. No surprise, the government introduced new measures restricting when people can leave their homes, essentially only to buy groceries, go for a walk a day, and for medical visits.
If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings.
The changes come as a group of healthcare workers confessed their fears.
We are facing our greatest challenge, and we're frightened.
We all have a choice. If you choose to stay at home, you will save lives.
Keeping those on the front lines safe is crucial. Efforts are underway to pack and ship more than 1 million masks and other protective items to healthcare workers in the UK. It follows the government's admission that there are not enough supplies for healthcare workers. The delivery has been tasked to the military. In eastern France, military members also called to action. This is one of many field hospitals being set up around Europe. With so many cases in Spain, a hotel in Barcelona has been designated a care location for patients with less severe symptoms. Never before in peace times have such steps been taken, in addition to border closures, curfews, and lockdowns.
More than 300,000 cases of COVID-19 have now been reported to WHO. That's heartbreaking.
Heartbreaking is the right word. Overnight, Sunday to Monday, there were more than 460 deaths in Italy. The new restrictions in the UK are aimed at preventing scenes like this. Goomansingh, Global News, London.
The National Microbiology Lab in Winnipeg is on the front line right now. It's where the Ebola vaccine was created. And as Global's Brittany Greenslade reports, it's now playing a pivotal role in this pandemic.
It's an unassuming-looking building. But what many don't know is this Level 4 National Microbiology Lab in Winnipeg is the battleground when it comes to the fight against infectious diseases and deadly viruses.
Winnipeg is heralded for what they do. They're looking to understand how these viruses emerge, what causes them to spill over, how we can contain them, and as well trying to identify new therapeutics and new vaccines.
Right now, the priority is better understanding COVID-19. It's where all of the Canadian tests are sent for confirmation, but it's also ground zero when it comes to research and a possible vaccine.
We can try and identify animals that are susceptible to this disease, to be able to look, how does one animal transmit the disease to another? A lot of it is to try to essentially develop animal models of infection so that we can actually test new therapeutics and new vaccines to try and figure out a mechanism to defeat this virus as quickly as possible.
Dr. Jason Kindrachuk is doing collaborative research with the lab for COVID-19 and says it's not just about a vaccine.
Ultimately, I think what we all need to be concerned about is, this virus is hiding somewhere in nature. So how do we figure out where it is so that we can try and stop it from spilling over again in the future? It's like trying to find the smallest needle in the largest haystack.
One, microbiologists, experts, and researchers are working around the clock to try to find. Brittany Greenslade, Global News, Winnipeg.
We know you have lots of questions about this virus. Our Jeff Semple will continue to consult with experts and try to answer them. Email your questions at globalnews.ca, and our website also has a special page dedicated entirely to COVID-19. You can visit globalnews.ca/coronavirus.